When we see a patient who has newly diagnosed prostate cancer, the most important thing is to go through their options with them in an open way. We know that most men who are diagnosed have options, and men who have very low-risk disease or low-risk disease, we know that they have a good option in what's called active surveillance. Active surveillance is to try and avoid potential side effects from treatments for a prostate cancer that may never otherwise affect them. Most men with prostate cancer end up dying of heart disease. So when we think that though many of these men with these very slowly progressing, very low-risk types of prostate cancer, they may die of something else, and these cancers may never affect them. The real question that we have to answer is, who is appropriate for active surveillance, and will they ever need treatment? We know that in active surveillance, if you look at the majority of series that are out there, by 10 years, about 40 to 50% of men end up progressing to treatment. But it's important to know that starting on active surveillance means that we're watching you, and if we ever see an indication that you need treatment, that is something that we would proceed with. We think active surveillance is an important part of care for men with prostate cancer. It's very hard to think about living with cancer. One of my jobs as the patient's physician is to help guide them with that choice. If they are worried about it, if they're really anxious about it between visits, that may also be a reason for treatment, because we have to take that important psychosocial aspect as well. This is an incredibly hopeful time for men with prostate cancer. When I started training in 2000, there were very few options for men with metastatic prostate cancer. Part of that actually is thanks to the PCF and the funding by the PCF. There is so much research that's being done right now, not just trying to optimize the current treatments that we have, but also identifying new treatments in the pipeline. The Prostate Cancer Foundation really, in my opinion, makes an incredible difference in patients' lives. It provides, the research that it's funded has really made an incredible impact in what treatments are available, systemic treatments, and also funding projects like mine and trying to identify ways to manage patients with localized disease. And then the other way is advocacy and patient education and resources for that. So when I call a patient with their results of their prostate cancer biopsy, I tell them to go onto the internet and go to two places. One, our Cancer Center website, but also pcf.org, because I know that that is a resource where they can go and get good information about their options for prostate cancer, but also to understand what is prostate cancer.